Don't do concept map now. Just want you to put it down. Right. Just make a note of it. Concept mapping in nursing, because you have to do this as a nursing student. You've started the nursing process. You started into the care planning. That's a requirement.
Thank you so much.
Because as a registered nurses, already right now you're registered nurse student. Concept mapping, the nursing process, care plans is what who you want to be. That's what you want. That's what LPN. Now, this here, your basic nursing concepts. This should remain with you license Iraq. Basic nursing concepts. You've done the nursing process already. You went through the nursing process. Can we do with that? We understand what the nursing process is. The psychosocial aspects of nursing. It is not just the physical problems that patients. So remember when we talk about what is health, and we say health is what's the definition? Health? A state of
well-being,
mental, physical, and emotional well-being, and not merely the absence
of illness.
disease. So basically, talking social, psychosocial aspects of nursing, because a lot of persons just focus on the disease. Then you have the principles of teaching and learning. You have to teach. Teach patients and teach your staff. That's very important. You understand the principles of teaching and learning. When you teach, you are sending information. Persons who are listening to you are receiving that information. What would be your concern? Are they assimilating the information? That is basically they understand what you're trying to send. It's like you're the telephone and you get in those static noise. Don't hear, right? You don't hear, it gets mixed up. You hear certain words, you don't hear others. You want to make sure you don't have no static. When you communicate, you don't want static. You want to be clear. And being clear means that every person in the group must get an understanding of what you are saying, not just one or two persons. When you teach family members, you may have a group of family members, father, uncle, auntie, and each one of them got their own way they think should be going. Especially if you have a lot of dysfunctional situations going on in the family. And he's saying, hey, I think this is what should be going on. The father might say, you don't know what you're talking about. I remember when my grandmother used to do the same thing, this same thing used to happen. Now you have to be one who have to teach all of these persons and get them to understand where you're going and where the whole process will be, so that they can buy into it and not be at each other's throat, or maybe come and get at your throat too. Okay, because a lot of times they have been around a patient with a chronic problem for a long time, so they know more about that patient than you. Then you have ethical and legal aspects of nursing. What do you think will be the ethical concept? What do you think is the ethical concept? Yeah, what's ethical? There's two words, ethical and legal. Legals go into the laws, right? And not just the laws related to nursing, but the laws related to the society that you live in. But what is the ethical? Should you allow a patient to die from starvation because this patient don't want to eat? Or should you give this patient a tube? Would you be going against this person's beliefs and rights? That's where we're talking about ethical now. Right? Ethical nursing is very important that you understand the concept.
have a question like if you, an example, know something gonna be good for the patient, but the patient did sign off, like an example, goes on the for example. And then a year later, the patient is right. So the patient is required to be able to give the patient blood. So would you like be ethical?
Does the patient don't wanna have blood, and the patient was alert and preventive when they make that decision. And whoever they have assigned as their healthcare proxy will be making the decision whether to give or not. Because that person will reach a point where they can't make decisions anymore. Because of the state they're in, they may become collapsed, right? It's unresponsive. So the person who's a healthcare proxy, if that person has a healthcare proxy, now have to make that decision.
I didn't have my healthcare proxy, it's just my doctor, he's just like, no, I'm not losing you, because I'm on it, right?
Oh, you?
Yeah, that was me, but when I
You want to make sure and ensure that when you are, like now you're alert and oriented, and guys listen up please. When the person is alert and oriented, and they may have situations that can be very much life-changing situations occurring in the future, they should consider having a healthcare proxy. Because a healthcare proxy can only be appointed when that person is alert and oriented, and not when they're having a problem. Okay?
I also got some other stuff about ethical here. It says here that relating to moral principle or the branch of knowledge dealing with this, morally good or correct, avoiding activity or organizations that do harm to people or the environment.
Guys, please understand ethics. As registered nurses, you must know what ethical nursing is about. What is ethics? Some people say, "Man, you have no ethics at all," based on the way your behavior is, based on the way you might answer questions, based on the way you talk to people. I'm sure you've heard a person being told, "Man, you're so unethical." I'm sure you've heard that before. You're so unethical. It's like saying, "Man, you don't have no moral beliefs. You're more moral than God," or something. So in these situations, it's based on what how society sees something, and not necessarily how the individual sees it. Because, for instance, I may want to drive a car very fast in the highway, but society, through the police, is saying that I should only drive at 50 miles per hour on the highway. But I got me a fancy BMW or whatever, and I want to hit what? 60, 70 areas. That's me. But society is saying, no, you can't do that. Okay? So rules are made to be followed, not made to be broken. So personal values, people have different values in life. Based on their cultures, and here's where your transcultural nursing comes in. But above all, you're now living in where? America. And what do they say? When you're in Rome,
Do like the Romans.
do what the Romans do. So if you're now in America, you gotta follow what's being done in America. Okay?
Another thing I wanted to find out, being ethical, if it's a matter of life or death, you still have to be ethical. It's a matter of life or death.
In what sense? Sorry.
An example, like when I said I didn't want blood, and I was so the doctor is like, no, you have to give her blood because if you don't give her blood, she's gonna die.
That doctor makes that decision, but if you had said before you did not and put it in writing, right, be documented, then you should sue him. I'm sorry if you're alive when you did what he did, because you specifically say you did not want blood to be taken, given to you, and he, in his own opinion, said that if you didn't get it, you would have died. But some persons with their religious beliefs don't want to have blood, like
I
Seventh
did not want,
Adventists
but
or
she
whatever.
gave it to me anyway, because she said it was a matter of life or death.
I thought it was 78 people. Not
And
78
that's
people.
why I
Them don't do blood transfusion. All we have to just let them down.
All right. So that brings us again to the legal aspect. Now, this is where ethical and legal comes in, because ethically, the doctors be doing something he thinks is right to the patient.
Yes.
But the patient himself has been saying, I don't want this.
And they do it.
Based on my culture, based on my religion, I don't want it. And once that patient made those statements and documented, the doctor should not be doing this. The doctor should not. You know, there was a time when, and I'm sure you guys have been following, when you had Dr. Kevorkian. You guys remember Dr. Kevorkian?
Yeah.
The guy who, if you want to die, you go to him and he will help you to die.
Oh.
Yeah.
But they wanna die, you go to them and they will have to
So
die.
you guys have been following news of these things? Look up Dr. Kevorkian. This went to the court, this went to Supreme Court. Right, you gotta call it this. See what's Dr. Kevorkian? And that's why we maybe some of this ethical and legal thing about that. Just read what he's about.
That's the way to kill people. Jesus. 2011.
So it's Kevorkian, Kevorkian, something like that. Somebody read please, so there are some lessons.
Was an American pathologist and
Somebody read loudly.
Dr. Kevorkian.
Listen please.
System information.
So let's go. Barbara, you were reading?
His name is Murad Jacob. Jack Kevorkian was an American pathologist and euthanasia proponent. He publicly chaperoned a terminal patient right to die by physician-assisted suicide. Embodied in his quote, "Die is not a crime."
Alright. So if you have persons who have diagnoses that say, you know, that he who says, I will help you to die. The law says no, you cannot, that's suicide. He was helping people to die. People wanted to die, so they go to him and he will help them to die. And it's just like when you have persons who have been condemned to death, they're getting a what? A lethal injection. So he does something same where he will just put in the necessary drugs and the person will just sleep away and die. Nice, calm, peaceful death.
Yes.
And so it went to the courts, it went to the courts and all kind of stuff and alright guys. We care who you like. All I want you guys to understand is the ethical and legal aspect. Alright? Right, but this thing was going to the courts and he decided he's gonna continue what he had to do and that's what happened. Alright?
I have a few lines. I'm gonna be a bad
Alright, so let's move on from that here and let's go to the last one on this list is a scope of practice and we went through this, right? So we look at the difference between an LPN and what you want to be.
There we go.
most schools or most places, they look at LPN versus the RN. Because colleges don't take you on for certain programs unless you're already a LPN. But the CNAs can't do it, and so we did read, you know, you can have CNAs and RNs too, utilizing whatever skills you have. Alright? But you must know what is the scope of practice that you are into. And this is where it's going to come into things like ethical. You'll be leading the team. You will be leading the team. Okay? Why?
You can.
Oh, you can't.
Look, if one person's having a problem, the person just step outside and have a seat and each other in the back.
Thank you.
Alright? Alright, now we'll go somewhat more into this today. But before we get into that, let's go back to last week.
You have a
I
problem?
said that this week I want you to look at PowerPoints. Right? So, hold a minute.
I don't know, the guy said just said, send the next person. I don't know.
So lottery?
Who need to see?
It look like everybody has to say.
One by one, sir, one by one.
There you go.
Hold it. Or you wanna see everybody? Or you wanna see the paper you sent? Which paper? The thing that they give you to write.
There's one to be, you need to see every person.
Oh, yes, on the ledger.
You got it?
They call it the ledger.
No, you got the names so they can know which
It
one.
says ledger on the paper, that's why I got the picture.
So when the person who come and see you, you tell them who you want to see next. So that way it will be
No problem.
a transition, okay? Alright guys, so let's go into your Microsoft, and today we're going to quickly look at PowerPoint. Why do we do PowerPoint? PowerPoint
You say?
is a wonderful way to communicate, teach, and it's exactly what the word says, PowerPoint.
Now
Now go to Microsoft Word and click on PowerPoint.
Microsoft Word. I put in an email.
If you don't have the word on there, please go next to somebody that you can see it.
I have it, guys. I have it. Microsoft Points. The computer's dead. You gotta put it on charger.
I charge it before I come.
The battery died quick. You leave it on the charger?
I charge it before I come, yeah.
Now after you've clicked on PowerPoint,
It was just.
it will come up.
Stupid computer.
While we're sleeping?
It looks so, because I said I know I'm charging.
Okay. IKEA.
I'm sorry. Yeah, sorry.
Well, she always saying that.
Why can't I get it one of
IKEA. Like Y-E-A-R. No, just imagine Y-E-A-R. Yeah. IKEA. IKEA.
I gotta get it here.
You said they want to see the paper. Oh my God, to go in my camera. Huh? Yeah. It's in my car.
Yeah, I was learning.
One day I'll get it.
I was learning so much more when we were doing the group stuff earlier. How was they doing?
They bring it? They bring in paper?
Do it every day. The little thing that you do for
I wish, but people don't have time. People don't have the time. Monday and Tuesdays, but I want to do it at least 4 times a week.
You're gonna do online again?
I'll make an announcement. I'll make an announcement in class before we leave. But you know, I'm available. Wednesday, Thursday, Friday, I'm working. All right. So on Saturday, I should be available. Saturday, Sunday, Monday,
On the
Tuesday.
Microsoft Office, in your office, you have PowerPoint, Excel, Word. You just click on PowerPoint.
Go to your email. Get on your email, the one you gave me. It should be right in there.
Are you guys clicking your PowerPoint?
Yeah.
Announce the PowerPoint? Let's see what you have. PowerPoint. You guys should
You want us to open a blank presentation?
I just want to show people got it because some people don't have it as yet, the PowerPoint. You got the app?
This is, yeah, I do.
Go ahead.
That's PowerPoint. Yeah, that's PowerPoint right there.
That's how I put my notes in.
That's PowerPoint.
Right.
PowerPoint. Look at mine.
All right, now on the task bars, you click on blank document.
Blank presentation.
Right? You
Blank.
go to where it says blank presentation,
Yeah,
click on that.
blank presentation. He already told us this. You don't want to go into it again. He already told us this. Let's go into it again. Right? He already told us this. Let's go through it again.
Give us some notes, man.
Say it nicely, say.
Yeah.
Nicely.
Oh,
Very nice. Very sweet.
On your serious blank presentation, you have one, and then to the right, you have a larger screen. You
Yeah.
go over, you take your cursor and go over to the large and click on it. Where it says click to add title, where it says click to add title, you put in any title you want. Any type of title that you want, you click, you put it in there.
Hey, give me a call. Give me a call real quick. I can't find my phone.
That's right. Microsoft Word,
I got it. Yeah, I got it. Yeah.
For those who don't have it, go sit next to somebody who have it that can show you.
Sorry, excuse me. So how many of you guys have the letter with you? You have yours? No.
I need a new one. Mine's finished. I need a new one.
You need a new one. Okay. So please do me a favor. If you doesn't have it for today, bring it with you tomorrow. If you don't have it, Give it to me right now.
If you have it, give it to him now. If you don't have it, you bring it tomorrow.
Feel lazy to
Okay, if you have it, take it to him
It's in the
now.
car?
Yeah.
Oh, it's in the house.
Now, put in the title. What's the title of your paper that you did for last week? Put that title in it.
Mr. West here, doesn't let you go together.
Yeah, Mr. West.
What kind of, look guys,
Please.
Come on, man.
Please, I beg. I beg.
no, come on, man.
Come on.
Guys.
You want your homework, we'll give it to you.
I beg.
Hey, I know that I want no homework. It's your responsibility.
That's how we
PowerPoint, let's get back to this, please.
Yes.
Now, write in a title there,
Duodenum.
whatever title you want.
Duodenum ulcer. Ulcer.
You write in the title in uppercase. Now I want you to size it. I want how you're going to size it is that you will click on it. You see those 8 dots? Shows up. Utilize those 8 dots to either bring it up or bring it in to give you the size that you want.
Mm-hmm.
You've got the size?
That one in paper, because the paper finished and they said they're gonna give me the right one on the bottom.
What you can see there, this is where it's at. And you utilize those points just like when you did the Microsoft Word
Mm-hmm.
to enlarge or make small. That's what you use for sizing. Whatever size you want.
Why you don't come and get started?
Now let's go to step 2. After you put in the title and you size it, click on the box beneath it. Click on
Let me see
the
yours.
box that's beneath it.
Highlight it.
Alright. Click on the box beneath it. And when that box
You want to see
comes
mine?
up the same way with those 6 lines, you're going to write inside of it. Your name by you.
Press it. Press it. Does it look like it now? Press it. Yeah, it looks like it's freeze up now.
You got. It's not the battery.
And you put in
No,
click
no, the
here.
battery
Click on
doesn't
this.
charge.
How long you had this computer?
Click on this one.
From last year.
Right. Now you write your name.
Oh, it's almost brand new.
Last year I had it.
Yeah.
Go to the next box after you finish, right? So in the next box is where you're gonna put your name.
You got it?
Alright?
Just look at mine, Mr. Man. Professor, look at mine.
Yeah, but show them how to get into the next box. Where to
Okay.
put the name. And you can, remember we were putting the letters at either in the center to the end or what have you? You can do the same thing with this. Like put your name down to the far right.
Mm-hmm.
You can change up whatever you want in it. It's for you, whatever you want to do with it. Now on this, I want to go up to the top of the, you put in your names? Now let's put it in so that now we're going to make it a little
Down at the
different.
bottom.
So go to the top.
Put your name down the bottom.
Where it says design,
Yeah, forget.
Click on design, and then you're gonna see a box come down that says design ideas.
You gotta
Click on
let me
one
show.
of those, which one you
Right.
like.
Highlighter.
If you wanna resize it, first you gotta
Click on
highlight it.
design.
Alright? If you wanna resize it, first you gotta highlight it, then you resize it. Alright? It's not gonna resize unless you highlight.
Click on
You
design,
resize, now you can resize it how you want.
and then at the far right corner,
This right
a
here.
column is gonna come up that's gonna show you different designs.
Resize it for you.
Which one of those designs you would like? You click on that,
Mm-hmm.
and that will become the design for your presentation. You can change it, of course,
Mm-hmm.
but it's up to you what you want to do with it.
That's nice. I like this one.
All right?
Professor, you should try to get your attention over there.
Why you guys are separate out to a separate group? I'm not gonna come to nobody's house. Tony,
Yeah,
that's
not me.
You see?
Oh, sorry, yeah. Now, after you've chosen your design and you got your design, click back on to number one, which is to the left. Click on go on to number one, put the cursor on that, and click. And you're going to see a second box going to pop up. You've got to go over to the left. You're going to click in that box, press enter, and you're going to get the second box going to come up. And in that second box, now you go over back to the other side because you can't write in the left hand side. All the writing got to be done in there. Big box. So you got to be switching between the two. So the same thing you can do. Remember in Word, you were able to size, fonts. You can do the same thing in this. You're able to insert pictures. You can do the same thing in this. So now I want you to try inserting and go to. I want you to go to 5 different options. Alright? Put in something in each. Whatever you want. But I just want you to get accustomed to how to move easily between the boxes, put in information, go back over to the front. Give me 5 different patterns. Alright, give me 5 different patterns. And then I want, in one of them, I want you to put in something interesting. I want you to put in not just a diagram. This time I want you to put in a video clip. So if you want to talk about, let's say, dieting, put in a video clip on dieting inside of it.
We have to go online.
Look at mine, Mr. West. Look at mine.
But I want 5 different boxes, different layout.
5 layout.
Wait. Don't worry about that up here. That's up here, it's not going to be here. This is what I want you to do.
Professor. Oh, I got it. I figured it out. Never mind.
See the people in your group who are having problems, and see if you can assist them.
By the way, guys, by the way, if you select on one slide, you can duplicate it. Once you duplicate it, you can change it up
I
how you
want
want
to
to.
see from each
Alright.
person 5
For instance,
different boxes.
for instance, let me show you. For instance, you see this slide right here?
I want to see 5 different boxes.
I can select it, right? Select it like that, and then duplicate slide.
Another box will have
Now I have 3 of the same slide. But whichever slide you're working on, you can always change it up whatever you want to do with that slide. Alright?
So we go this time.
You go to the slide on the
You
side.
guys want what I'm asking? I want you to put 5 boxes. Or
5 slides.
slides is the normal the standard use. I want to use 5 slides. Each slide must be of a different pattern.
Mm-hmm.
And in one of the slides, I want a video clip. In another slide, I want a image. But everything must be pertaining to the same subject. If you're talking about the heart, everything in all 5 must do with the heart.
Mm-hmm.
And it must be something that you want to show or tell somebody.
Okay.
It must not just be for fancy look, but something you want to communicate to somebody else.
Mm-hmm.
But I want to see how you're using your slides, how you're using your images, how you're using your fonts and sizing.
Understood.
So video is gonna be right here.
Now let me see what you got over there. Let me see. Alright, so
No. So,
you want to make this bigger, right? So you want to select.
when you want to enlarge this,
You want to select.
put your cursor right here. Right
How do you select everything?
No,
You select everything, right?
Once you see
And then
top,
over here at home, you're gonna say,
boom.
hmm.
Then, boom.
You're gonna say the size and
Okay.
what is this?
You can do the number.
Fall.
They can be like 38 or whatever.
I'm gonna undo everything.
Oh.
So you still.
Alright, you select it, and then
I'm showing you.
it's supposed to be at home, right?
We can also go to number 5.
Right here. See the A right here? You hit the A, it's gonna make it bigger.
Oh, gotcha.
You understand? And you make it as big as you want. You make it as big as you want. And then the bottom here, you do the same thing. Go home. You make it as big as you want. And then you go to design. Alright? You pick one of the designs available. Alright? You pick one. Alright? Go to design. Let's see. Let's see the different designs you got. Alright? You pick one, right? And now that you have a design, what you do now is you can start to arrange the words, right? Take this. Take this. No. I don't know how it works with this, but use the mouse. Use the mouse. All right. You come to the side, the upper corner of the box. You're gonna see like a selection thing, right? So you select it, you pull it to the side. Now it's gonna go to one side of the thing, all right?
You gotta finish this in 10 minutes. 10 minutes. Come on. Let's just do things. Once you click, it's gonna pop up, right?
Yeah.
And now you gotta copy and paste. That's going to be the most difficult part, getting the correct thing. That's the most time consuming.
I'm downloading the
But just
pictures.
clicking it and copying and pasting should be.
You copy, I think you can copy.
image and every put it in a video.
No,
So
you
just
put an
try to move it around, right? Try to move it around.
You know, I mean, I because that mix it up.
I already have YouTube.
This is your new thing?
Yeah.
This is your new
No,
thing?
that's not the new one.
Because you want it by so small.
Because I use the one. I got the Microsoft.
Here.
So wait,
I'm a phone when I'm
Rose, how far you got so far?
why is moving like
Right?
why is moving like
the
that?
internet is like so slow.
Sorry, I'm still
Yeah,
not sure about
because
that.
a lot of people on there.
No, mine's messed up. Wait, mine.
You lost? You lost?
I am. Definitely.
All right, you gotta physically come over here so I can help you out.
I need five. Guys, you're taking too long now.
No, we're not. I mean, yes, we are.
Yes, you are.
Yes, we are. I said that. Yes, we are. Yes, we are.
Look at the amount of downloads you have on your.
Mine was like more organized. So now.
No, come. I gotta show you. You gotta come here so I can show you.
You have downloaded anything? Right? See what you can.
It'll take 2 minutes.
Is the way it's supposed to be?
Okay, put it right here.
Like so? Okay, mess it up.
No, what you gotta do is click on this, right? See this box right here? Just like that. When you bring it to this edge, you're gonna see that little square thing, right? You tap it and you move it to the side, like that. You wanna fix it before you resize it. Right now you're fixing it. So you come here, like that, move it to the side, to this side like this. I'm going to resize it a little bit more.
You know what? I'm gonna fix it. When I'm fixing it, I'm gonna change the thing.
You can always do that too. Right? And then what you do now, you want to make it bigger. You want to make it bigger so it pops out.
Okay.
You understand? So what you do, you highlight it, you go home, and you hit this. Make it bigger.
I don't know how much bigger than that.
Oh, that's right. You're showing exactly what you do to make it look like a presentation, you know? Bring it down, like this. Come to the edge. Like that.
Yeah, I think you put it there. I'm gonna fix it.
You want to put it right there?
Yeah.
So you know what to do, right?
Yeah, I would do it.
You tap it, you move to the edge, you see the little thing, you hold, you grab.
Alright, it can look like that, yeah.
Alright?
Yeah, thank you.
Anybody else need help?
Download Microsoft.
Sasha, you need help?
I'm getting it, thank you. I'm trying.
Are you getting videos?
Yeah.
And you gotta click on it now so you can open up the play. No, come out of the game or back. When you copy, so we say like copy link or copy image or this is what you copy.
I've got the problem. He just would you like
I'm about to finesse it real quick. Give me 1 second. I'm gonna show you exactly what I'm gonna do. It's gonna blow your mind away. It's gonna blow your mind away. Watch this. Watch what I'm about to do. You see this right here?
I don't remember. I don't know their
He wants to play with it and learn how to be creative or whatever. Like he wants you to look
I gave it to you that back in the days. I sent it to you. She did it.
I'm talking about the art, girl.
The human heart.
I did it. Look.
You got it. You figured it out.
So I inserted, I just type it because they want to say, oh, you don't know YouTube, right? Right, so you can make like
Disruption of integrity of the stomach was within.
Go back to and hold it down. Like you gotta hold it and go across. Like yes, go. Yes. That's good. The trauma that you know what's so now you don't look at that anymore. Now try to delete it.
lace. What do you have to do?
What you trying to do?
I want to either that no. Wait.
You got it?
No, I don't my two.
Guys, under your designs, you can find all kinds of designs. Whatever design you want, snakes, animals, anything you want.
That's a
Then go back to the right, so we
We'll just get the image.
Right, no. You don't want something. You don't want
You do like this? Look at the
No, because I come and stop here.
Stop there, but
So we'll do it like that. We're gonna insert that video.
the video one.
Yeah, that's
You got the video into yours? Yeah. Okay, there you guys go.
He showed
Look at this.
how to get the Microsoft Word.
Look at
I
that.
have no idea how to get Microsoft Word.
You see that? You see the video. The video. Got it from TikTok. TikTok.
Just hiding my Microsoft.
Oh, you went to
TikTok. You get it from TikTok.
So you copied and pasted that on?
You want Microsoft Word? Give me your email.
You copied and pasted that on?
I'll send it to your email right now. I download it and I just paste it in there. You gotta upload it in there.
You have TikTok app? You got on your phone?
It's a website. TikTok's also a website. I didn't know that.
Oh, I didn't know that.
I didn't know that.
Because I got the app.
I used to always go on my phone to do my studies. Yeah, so it's a website. Guess what the website called? TikTok.
All right, guys.
Go TikTok.
TikTok. All right. All right, by 7:50, we have to close off.
Give me your email. Alright. Oh, what's up, right? I got you. Oh Lord. I couldn't do 5 slides. I put everything in 2 slides. I'm sorry. I'm sorry.
Like when you finish your slide, your slides it could go forward like a movie, right? Like a movie.
It can, if you wanted to. I got you.
You have to save it. It's here wait for you. You have to save it to the phone. If they come up with you like that. No, you're gonna save to your thing because everything connects to this, right?
When I get home, I'll send it to you. Alright? What I'm gonna do is I'm gonna send you the whole Microsoft Office. Alright? I'm gonna send the whole Microsoft Office. You're gonna have PowerPoint, you're gonna have Microsoft Word, you're gonna have Excel, you're gonna have all that. Alright?
You wanna do it?
Alright. I can't, because it's too big, the file is too big. I'm gonna send it to his email. I'll send it to the email. I think I do. No, just resend it to me because I got a lot of stuff. One second. Huh?
So whatever you want to save, like you have this.
You do an iPad.
My iPad, I save everything to my phone.
You can still do an iPad. That's what a good idea. If you do iPad, you're sending the information another way. What you say? Are you laughing? What you say?
She likes to laugh. I'm trying to make the video.
You trying to get the video?
Yeah. They're gonna get an image.
You gotta download the video. You want the video or the image?
I'm not gonna get an image.
Image.
No. He's trying to tell what you should be like. Teacher just wanted to get it right.
About the first one, on the second box, you can just play around and do whatever you want to do.
What this box?
You click on the box, go into the box. Tap on the box. Now, when every box that comes up, will look the same way with the two compartments, right? And then you write in the size, you can do whatever you want. But where is it? Okay, that's a one. Then go to another one where we got the design. See where it says design. I'm clicking design and it's gonna pop up.
Here, and you know to have more slides.
Alright, pick up any one of them here. And whatever you like.
Okay.
But you see how down here still you have the two boxes? Right, and you are checking the box and what you want to do. Then you're going to be writing, but for now you're just picking design. How many does it?
Every time I try to
accelerate.
do my so it's just go by link in my
Alright, go by link.
Yeah.
Link in here. Save the link, you will be control.
You found all the videos on TikTok.
You guys good?
You found all. You don't bite off my skills. Don't bite off my skills. Okay. You can.
Like that other website, look up for and what was it? OS.
Oh, you talking about the WebMD? I know.
You had those images.
Yeah. I'll tell you about that in a
They
second.
don't want me to take your time and do it.
That's only sometimes. Sometimes it comes out like that. Sometimes. Not all the time.
When it goes as a picture, come to the picture, and come to the
Copper. Putting 14. I might change that up a little bit.
You can.
So.
She wanted to do the word for the woman. We're trying to care for her, but
Exactly what you
just spell it for her with the 8 of them so she can just type it.
Oh, the 8?
Yeah.
Alright. So give me your email. I'll send it to your email right now.
Just open it.
Yeah. Did I say last week my birthday's tomorrow?
Yeah. You said that. Yeah. I think so. You did. Yeah, you did. Happy belated. She wasn't lying. Alright. Look, just text me on WhatsApp. That'd be faster.
Copy that. So how do I get the image to come out? I just copied it and I pasted it.
No. Take that out. Go back to the image. You gotta save the image to your desktop. Alright? After you save the image to your desktop, you gotta go to your desktop and drag the image and drop it right on the you know what I'm saying?
Okay, go back to the image.
Yeah, first you save it to your desktop, then you drag it.
So I got the image.
Save it to your desktop.
Save it to my desktop.
Yep. You're not bothering me. You're not. Listen. You're not bothering me, alright? You're not bothering me. So, I'm coming.
I like that design. I went back to design.
I'm gonna send it to you. Just give me your email. Give me your email. No, what? Text it to me on WhatsApp.
It's not.
No, not in the group. You can put it in the group. Put it in the group.
You're not in the group?
Matter of fact, don't put it in the group. Send it to me in the personal email.
I don't have your number like that.
That's your number.
That's my number on that. Yeah, send it to me in there. So whatever picture you want, right? You just select it, right? Save to, right? Save to, right? Save as, right? And then save it to your desktop.
That's what I wanted to get.
Alright guys, just separate out now, please. You gotta close off 7:15 like I said. Please close off.
And then as it's open now I can
Now you get back to your
outside. You can't get the door.
You gotta open this first. You gotta open it like this. Where's his name?
The key is outside.
Right guy is right there. He's right there. He's right there. Now you gotta get back to your thing right here, right? Right? And then open that. And then what you do now, you just drag it and drop it. You know what I mean? Easy. So I just we get it done. You know what I mean? Just like that. Like that.
give me a
He got locked out on the door, but I didn't see it.
Oh, yeah?
Babies would have challenge for that.
Okay, he knows. Oh, yeah. Okay, so. IKEA.
I must have 50 times IKEA tell him name. Oh my God.
You get it?
I'm coming.
I want you guys to listen. I'm going to read something. Just listen, please. And listen carefully. Medical surgical nursing. It utilizes National League of Nursing educational competencies for graduates of the associate degree in nursing. That's what you're doing, right? The associate degree. Their quality and safety education for nurses, which is called the QSEN, model for nursing education, and ROI adaptation model, which is called the RAM, as a basis for providing nursing care. This course encourages the use of critical thinking and increased self-direction in the utilization of the nursing process, which you did, to the care of adult patients experiencing stress related to acute and complex health problems. Emphasis is on understanding of concepts to promote adaptation under life-threatening physiological stresses for patients in acute and ambulatory settings. Increased independent learning, and now listen to this, very important. Increased independent learning is expected from students. Let me say it again. Increased independent learning is expected from students. A student-conducted workshop on selected nursing technique is arranged to provide students with the opportunity to organize. That's why you get in groups. Articulate and share their learning experiences with peers and with faculty, which is me. That's why I get into groups, right? The leadership role of the registered nurse as a member of the healthcare team in a variety of settings is examined. I'll be next emphasizing from day one, leadership skills. And that's what you have to be doing, because you're a registered nurse, you're a leader. You're not an FPN, you're not a CNE, you're the leader. And it's not just leading the nursing team, you're leading the healthcare team. When you have care plan meetings, you're the team leader. The only time you're not the team leader is if the doctor comes to sit in on the meeting. And once the doctor sits in the meeting, he immediately becomes the team leader. Other than that, you are the team leader, not the dietitian, not the therapist, not the social worker. You are you who is sitting right here, is the person who will be leading the team, calling the shots, and saying where you. And that's one of the areas that I've been trying to focus on with you for a very long time.
So I put you to do, like to do certain things. Because leadership skills is something that requires. Now, clinical experience includes specialized abilities to lend themselves to the application of knowledge to practice. Now, just listen to this here, please. What is expected at the end of the program? You must be able to describe the basic concept of nursing, including professional behaviors, communication, assessment, typical decision making, care and interventions, teaching and learning, collaboration, and managing care. You must be able to discuss biophysical and psychosocial concepts as they relate to nursing practice, individual and family homeostasis, stress, and adaptation, transcultural nursing, genetics and genomics, chronic illness, rehabilitation and care of the older adult, understand concepts and challenges regarding patient management, including pain management, fluid electrolyte balance and disturbance, shock and multiple organ dysfunction syndrome, oncology, and end-of-life care. Describe the basic role of the nurse in perioperative care, preoperative care, and intraoperative and postoperative care. You must be able to implement safe, effective nursing care for individuals with diabetes, hypertension, vascular disorders, integumentary disorders, immune disorders, infectious diseases, cancer, with rheumatic and musculoskeletal disorders, and chronic neuromuscular and neurological disorders, and medication calculation. You want to be able to describe the nurse's role in assessment and planning, implementation, evaluation of care for patients with infectious diseases. That's very much like saying, hey, ADPAD. Understanding the nurse's responsibility related to health promotions and maintenance in the community, promoting and maintaining health, and meeting the needs of their older adults. I go on and on and on. Now, what I read there just now is basically telling you guys that I have been giving you these things from day one, but I find that persons have been emphasizing more listening to what the doctors, diagnoses are. And that's a wrong concept. I'm trying to get you to understand that your knowledge, learning should be based on the nursing process and the nursing diagnosis. Lots of persons are, and so you forget all about this part. And you say it's a basic, not advanced. This is a basic thing you should know. So now when you put all the other stuff into place, you will not have a problem. Up here, for this week, tomorrow, we're going to be doing this. Because last week and the week before, we've been focusing a lot on the GI system. I've asked you to do assignments. We look at the nursing process. I had you guys go back and do it different ways so you'll learn and not give you all at one time like that. And so you get overpowered and overwhelmed. I give you piece by piece along the way. But these pieces have to be put together. If you don't put these pieces together now, you're going to have a little challenge. It's going to be very challenging. Remember when we did the heart? We broke it down into 3 areas, right? We broke it down into the heart, vascular, and components. All right, that was a basic anatomy and physiology. We started to go into blood disorders as we were coming to the end of the GI system, right? The anemias, we start talking about when persons get jaundice, what causes jaundice? Right, the bilirubin, the hemoglobin, and that sort. That's where blood disorders. So it's one's leading from one thing to the other to show that things are connected. Now we're going a little deeper into the disorders of the blood. And we now going, if you remember, just now I said we look at the cardiovascular system in three parts. The heart, the vascular. This here is looking at what? Vascular. We're looking at what? Arterial disorders and venous disorders. So you're not looking at blood disorders generally. You're looking at blood disorders that affect your arteries. Blood disorders that will affect your veins. Because the capillaries is where all of the exchanges take place. Everything that goes on in the body with reference to exchange of gases, nutrients, what have you, happens at the level of the
Capillaries.
So now we're looking at the disorders. This is what's bringing it to the capillaries, the arterial, and this is what's taking it away from the capillary, venous. You guys with me? So this is what you'll be focusing on tomorrow and Monday. 2. We're going to be moving, after those 2 sessions, we'll be moving over to diabetes. And we'll be looking at diabetes, exactly the way I put it down there. Type 1 diabetes, which is usually juvenile diabetes. Type 2 is adult onset diabetes. And we'll be looking at it, risk factors, who's at risk. Screening, how do you screen these persons? Treatment. And the treatment is based on whether they have type 1 or type 2. Lifestyle. That's where your patient teaching comes in.
It's in the WhatsApp.
Lifestyle what? Modifications. What they need to change. Medications that the doctor will order. Because remember, insulin is just the injections that you get subcutaneous, right? And we did the subcutaneous layer. We said that you can do things in the subcutaneous, hypodermal, lysis, and all kinds of stuff. We're talking about the insulin doing there. We have other medication, which is the hypoglycemic medication. And this we just write them up with pills, right? So we're going to be looking at that. And then, of course, prophylactic or prevention. You know, they said that onset prevention is better than the whole program. Sure. All one prevention before it happens. And so that's where your patient teaching comes in. That's where your family teaching comes in. That's where you're teaching to your colleagues, especially to your CNAs and your LPNs will come in. Because you need to share, you need to tell them what you want from them. You need to let the CNAs know if a person that you're taking care of look feel like they get cold or they start talking, it just don't make sense because they're going into some kind of hypoglycemic coma. Or is it a hyperglycemia? Things that they should be looking for. That's what you'll be doing. That's what you have to do. So this will be tomorrow and the following day. And Tuesday, we start in this. This here is throughout the time that you are in this class. I mentioned before, right? Remember I told you guys you'll do what? 3 things. And the 3 things were?
Evidence-based practice.
Evidence-based practice. When you get all the evidence together, you have to make a decision. And that decision is based on critical thinking.
Critical thinking, yeah.
As registered nurses, you have to do critical thinking. But you cannot do critical thinking based on hearsay. You need facts. That's where evidence-based practice comes into play. And third,
determination.
Determination and dedication. Dedicate yourself to what you're doing. Time is short. Marmy is going to be around here very shortly. the mind is what you need to control at this point. You know, they say mind over matter. Now it's going to be intellect over mind over matter. Let your intellect make you make those decisions over your matter. So please stay focused with me. All right, please stay focused with me. The leadership skills, you have to develop leadership skills. It's not something that maybe you have to develop leadership skills. And I've been given some persons that say, oh, I can't handle that. Unfortunately, that's not what it is. I give some persons a long period of time and said, look, go follow with it. Get accustomed to it. Because you will meet persons with different personalities. You'll be working with some persons who will be stronger than you are. Stronger than you with a sense of being able to make decisions. Stronger than you, maybe even skill-wise or knowledge-wise. Because you got some LPNs, I can tell you, put RN to shame. Yeah. And why they can do it is because they have been around in that specific area for a very long time, so they know everything like the back of their hands. But when you go in, you're still the person who's in charge. And you still have to have that functional superiority where that person's reporting to you, you're not reporting to that person. If something happened on the unit, it's you, not that person. So that's where those leadership skills come in. And when you get into those groups, now look for something called RAM. Roy Adaptation
What is RAM?
They're going to give you a vote, a male vote. Look for Roy Adaptation Model.
Roy Adaptation Model.
Model. In nursing, you'll be doing a lot of models, especially when you get to do your BSN. Your BSN, you have to do
Roy Adaptation
a whole
Model.
lot of models you'll be doing. But for the learning, let's try Roy Adaptation Model.
It's okay. It's okay. What is this?
So you guys were all from RAM? Roy Adaptation Model? Anyone want to read?
According to Ryan, the purposes of nursing is to increase compliance and life expectancy. The paradigm concept of Roy adaptation models are person, environment, health, and nursing. The word adaptation model sees the person as a biosocial being and continuing interactions with a changing environment.
You can find that persons who go, for instance, when you are in your native country, you would look at healthcare differently than when you're here in America, right? If somebody fall down in your country back there, you run and start to do what? Bring a bucket of water, trip on them or something, right? In America, if you throw a bucket of water with somebody, you're going to get sued, right? So you got to adapt to situations. You must be able to do things that is in line with what that society wants. So your training has to be along that line. You cannot just assume this is where you're going to do things. You have to adapt. That's why there's such a word as flexibility. It says you have to be flexible for changes. You cannot be rigid, because if you're rigid, you're going to break. Flexible, you can bend and come back. I remember many years ago, a teacher taught me that in a hurricane, you have a big, strong oak tree. When a hurricane wind comes, it tears that whole tree out of the ground, rip it up. Now you see the air's roots. And then you have the little willow tree. When a hurricane comes, the willow tree bends right down to the ground. And when the wind is gone, it comes right back. So sometimes in life, you've got to be flexible. As nurses, we have to be flexible. You cannot be rigid. You cannot. The only time you be rigid is when you're dealing with laws. Because the laws are changing. Policies are changing, not for you, for anybody, until they decide to have a group or whatever they do to change it. So, based on that, so adaptation, what is it that you, and this is really going to do personally for yourself, not for anybody else. What do you have to do? What do you have to adapt to with reference to your learning? What are changes that you have to make? Don't look at anybody else. Because each person in this room is a unique individual. Don't try to be like anybody. You know, there's a saying, when I grow up, I want to be like Mike. When you grow up, you want to be like you. Or be all that you can be, you know. The United States Army, be all that you can be. That's what you're looking for. Look at the standards the society wants and see where your standards are at. Look at what the nursing wants and see where you're at. Over the period of time that I've been with you, I've been gradually, because I know for some persons it's going to be a problem coming and give you things like this. Because at that time, you cannot see what these things has to do with nursing. Now you're getting an opportunity to see where it is and why you need it. But you've already got it. But you didn't know where you're going because your idea at that time is, man got diabetes or he got, this is what we got to do. Was it at what level? Was it at the LPN level? Was it at the CN level? Or maybe was it even if there's a person out in the street who might know home medicine? Homeopathy? Bush tea? And there's nothing wrong with that. There's nothing wrong with that. But what your critical thinking is going to tell you, a person who's drinking bush tea going to have a problem, right? What problem are they going to be having? Why would you think a person who drinks bush tea would have a problem? Do your critical
Some
thinking.
medication is not to be combined with like those.
So the bush tea can be, but let's say you're not using medication. So what would be your concern?
As a nurse, I would advise the person to go seek for
Person, I watch. You kidding me? My grandfather, father, used to drink it. And they were healthy and strong, used to cut you with it every day. So why is it that you tell me I can't take it? So what would be your critical thinking for patient teaching? Because you're told you have to do patient teaching. So what is it you're going to be telling us with reference to using these home remedies?
What, Margaret?
Might be having something you're not supposed to have.
Might be having something you're not supposed to have. Well, one of the concepts I would like to focus on, when you drink medications, you have a dosage. When you drink tea and bush tea, in no
I always
dosage,
tell my mom that
they will be drink, and if they like it, so you don't know how many milligrams you get.
every morning she will put a lot of like herbs together, and I'm like, Mom, you don't know the dosage. Like, oh, you believe in doctor too much. It's just, I was not even in here. She told me I believe in doctor too much.
Remember, a lot of these medications that we use today
And they stopped
was
me.
made from these same herbs.
Back days, I can say that. The back days, some people believe in natural things. The old people, they believe in the natural, but sometimes it's working.
Of course, things and work, and that comes another part of it. You know, for pain management, and someone was talking about pain management a short while ago. With pain management, now it's not just giving pain medications to a patient. Pain management is now with distraction, non-pharmacological approach. Give a child video games, and pain is gone. Even give some big brown men will be like, oh my God, pain in my foot. You give that video game, because a lot of guys like to play video games. And you get into that video game, that's where distraction, virtual reality.
Them for go to school, they make them stay home, they pay
And
now.
we tell what games you play. I know what games you go play. Alright. Well, we talk about virtual games, right? Distraction. But seriously, guys, seriously, and that's where your ROI adaptation model comes in. You're making changes that's helping the patient. Before, we would stick that patient with everything you could think about, right? We give this patient a whole lot of medications. But the mind,
Sometimes you don't want to take the medication.
the mind is important.
Sometimes they don't want to take the medication, the patient, because sometimes they believe in the natural thing. That's why
Right. So when the patient don't want to take the medications because they believe in the natural thing, what is it that you're going to be doing to work with this patient? For one, compliance. Compliance to the medical regimen. Because the patients, from this where you go to ethical nursing may come in right now. The patient may be needing blood or blood products. But the patient is not, I'm not taking that. My religion do not accept that. And even today, with the COVID-19 and the vaccines, you heard by the 19th of next month, all policemen who do not take vaccines, they're going to lose their jobs. So we're going to be looking forward to. So you have an actual situation that can occur, right? There's actual loss of job, potential problem. That's your nursing process. Now what is the potential problem? It can mean now, potentially, there can be an increase in crimes because you have less policemen on the streets. You can have right now, you may have policemen who may decide that they're going to do what they got to do.
And some will still refuse
Do what they
to
got
take
to
the, some will still refuse to take the
Right.
vaccine.
So that's how the nursing process will come. You look at the actual situation, then you look at what? Your potential situations. What can happen?
Nurse on my floor, so much in years and since the vaccine. Because they're not taking it.
During the corona, a lot of people were dying.
You know, today, when I was with another class teaching, one of the things that came up is that a lot of patients are not patients really, but people in and out of the hospital or the healthcare setting are getting addicted to drugs. And the one that people really, because we were talking about fentanyl patches and diversion of medication by nurses and doctors. Nurses and doctors a while ago used to make a lot of money in that because they will now sell it to people out in the street who are ready to buy it. But guess what?
What's the name?
The fentanyl now is coming into the country from China because it's what? Synthetic. So the market is being flooded. Last week a child died.
Yeah.
And he had hundreds, not couple, hundreds of fentanyl. And the fentanyl has more potency than in heroin. Hundreds of times more potent than heroin.
And they do it, they just patch it?
So the kid died last week. But the question is, yes, he died from an overdose, but where did he get hundreds of fentanyl? So what I'm trying to say is that the market, and people used to get upset with Trump, right? Remember Trump had said, Chinese, you gotta stop. And China said, no, we don't know nothing about this. It's private companies doing it. But there's a lot of crap going on out there with politics and what have you. But what is happening is the common people who are suffering. But we cannot do like what's happening in the Philippines. You know, in the Philippines, the president had given the police officers the right to shoot the drug dealers and the people who are using. So that thousands of people were killed in the Philippines. Good guy. Because he said, the thing is, if a person's addicted, you use him, shoot him.
Yeah, society.
So you had thousands of people being killed, and that is not right. You don't know why a person got addicted. If you're going after the drug users, you can understand. And this is where we come now again to ethics. But guess what? In the Philippines, they only have 2 terms, and his terms are finishing. So guess what he's doing now? He's putting people in place that when he is out of office, they're not gonna bring him up for trial. So this is an ongoing thing. Where we had President Trump. Remember, he put people in the White House. He made certain. And now the Democrats are doing the same thing with the new person, first female, whatever they're gonna, black person to get to the Supreme Court. Alright. But I want you guys to not just look in a bubble. I just said think outside the box. See what is happening in society and how society is being affected by what's going on and how it affects you as a nurse. Again, RAM, Roy Adaptation Model. I've been focusing a lot on leadership skills, and I'm going to say it again, you have to be leaders. You have to be assertive. You must be able to communicate and articulate what's going on in your head. If you just keep back quiet and not do this, when you're put into a situation where you have to talk, you're going to be so stressed out because you have not been practicing. And now you're going to be put into situations where you will be required to talk. And what are you going to do? What are you going to do? Say, no, let you do it? I can't do it, let you do it? No, can't do that. So utilize these groups, guys, utilize the groups. The reason why I put you guys into groups. And don't come and I see some people just sitting around wondering, chatting about different things that is nothing pertaining to the money that you are paying salary. Nothing to do with these classes, but you are paying for the time. And then when he don't pay me, I go to him for my money. So if you guys want to come in here and sit down and talk nonsense about your life at home and then start a stuff, God bless you. That's all I can say, God bless you. But all I'm going to do is teach you what's right and what you're supposed to do. Right now, we are giving you the points along the way so you won't feel overwhelmed. We bring it together. We bring it together now. So you need to do this. Put yourself into this shoes right now, okay? Be that student, nurse, your college student, every one of you is a college student. Believe it or not, every one of you is a college student.
Tomorrow's a new month. We have 5 tomorrow. What? When's your birthday?
Tomorrow.
Oh yeah? That's what she said last time tomorrow was her birthday.
I was looking look at her, tights and everything. So that's a that's a pre-birthday setup. All right. Well, I wish you long life, prosperity, and happiness, and that you will be all that you want to be.
Amen, I receive it.
Amen. I receive it on your behalf.
What? That's your birthday too?
Huh?
Yeah, twins.
No, no, no.
Yes.
I got one question. I know today I saw when I came in, Kia was doing Coumadin and these anticoagulants with you guys, based on, I guess, was it surgery he was doing?
No.
Another question for the
Was based on
Hematologic. This is I'm sorry.
Is it based on the one?
The last question.
I mean, my question is, what is INR?
Yes.
International Normalizing Ratio.
International what?
Normalizing Ratio.
Was it N word?
Yes.
Ask the many persons who are sitting here, what is INR? Ask the persons who are sitting here. So that's what I'm trying to get at. You guys got to be able to understand what you're talking about. And don't just listen to words. Right?
Yeah, you said that something about the person.
So
No,
don't just hear INR or KGB or something. Understand what it is.
It was like some
Okay? Or to be cramming words,
when you are being
which is not something you want to do.
You go crazy.
He said
What is INR? All I want you to do is what is the word INR. That's all. Well, why not?
Yes, I did. He did. But I don't know.
No, I'm listening to what you're talking about. Why is it
Whatever medication.
Professor, we actually did look at it while we was doing the question.
No, just stay with me. What I'm trying to get over, right? You guys were doing something that INR
Was
pertain to, right?
was important, yeah.
Right. But persons were listening, but sometimes you don't listen, but you're not hearing. You're listening, but you're not hearing the message. And that's the concern I really have. Listen and hear. And not just hear the message. Because a lot of times we listen. Many times see a person in the groups are listening, or anywhere. And then when you say, hey, you know, oh yeah, man, the man talking about that. Yeah, listening, but they're not hearing nothing. Maybe your kids. When you talk to the kid, well, you know this is not when you get very, there's all this psychology and you just do this way and that's how you. And then you say, you hear what I said? Because nothing you said. You've been tuned out already. So you can't do that in this class. You can't do it. You gotta be focused. Remember I tell you guys you gotta be very specific. For this year I want you to be very specific with everything that you're doing. So that the challenges you have, it's a lot of challenges. Working hard, then coming here, home situations, personal life, and then have to study. It can be rough, and I understand this. But you made a commitment. You made a promise. I know when you get married, we'll say, for better for what?
Yes.
So, when you got the better for the worse right now, you gotta stick with both of them. Good times and the bad times. And you don't just say, hey, I cut it out, I divorce you.
The better will come after?
There's no divorce.
Professor West, the better will come after?
Absolutely. You know, there's also saying, There's light at the end of the tunnel. When you go through the darkness, you'll see light at the end of the tunnel. So some of you might be going through your darkness right now, but there's light up ahead. Have to what? You guys are teaching me things, you know, the same thing.
What did you say? No, I said when you go down, like you have to go to the desert first, you have to pass through the desert.
You have to pass through the desert before you what?
To which Canaan?
To which water?
Canaan, like the village of Israel.
Canaan?
Canaan.
Canaan.
Baby, I don't know. I know you say English.
The water is the church.
Canaan.
Yeah.
Canaan.
Canaan.
Canaan. The land of Canaan. It's good. There's no problem. You understand now.
That's another. That's where we go. Yeah.
All right, so
I'm not too sure about Saturday. I'm trying to do Sunday, Monday, Tuesday.
I give you guys something
Sunday
else I
night,
asked you to
Monday
read up
before
on.
class, Tuesday before class.
And what was that I give you guys to read?
Yeah.
What did I ask you guys to read?
Venus disorder. The
What's
Venus
the first thing I
thrombosis.
asked you guys to read?
Two component of the vascular.
The what?
When I was here,
I asked you guys to read.
Concept, nurse concept. The nurse the concept map, yeah.
Concept
Concept
mapping,
map.
nursing. Concept mapping of nursing. Understand it. He said to understand it.
Just read and
Look over it.
you got to know view and insight. That's when you get information all the time. You get.
No. Yes, that's what you want. That's what I said.
No, everybody needs to understand things. I don't want no one person and the others don't know what's going on.
Yes, Mr. President, talking about identify.
I
want to know what's
Miss,
You're gonna find where the mapping concept, when you do that concept mapping, you have to have a specific primary diagnosis. And then come out to this primary diagnosis, you have to put in what is your nursing diagnosis, how you come up with that. That you're just saying subject and objective data and what have you, just like when you're doing it. But you're gonna be, look at, there's lots of models. Look at the models, please. Because I kind of tell you, I've been telling you all along, everything you do, you put it into AdPy, right? That you would start off with your concept mapping. Everything you put into AdPy. And when you put that in there, that's where you can look. Now look at your concept mapping, and then you're going to see what that means. Look at the model, and you're going to see it.
just look it up.
Yeah, look it up. Look up concept mapping, read, see what you understand about it, and we're going to talk, we're going to go in depth.
To put it in order.
But you're going to see, and you're going to learn. I don't think I even have to tell you anything because you did your nursing process. You did your AdPy. And so with this mapping, you should not have no problems. No problems with concept mapping of nursing. And this is specifically for nursing students. Okay? I don't know, I just said you guys remember I want that to Now, meeting the needs with meeting the patients with vascular disorders and peripheral circulation. When we talk about peripheral circulation, we're talking about circulation that's going towards our extremities, right? The peripheries. And lots of times, persons may have a problem with circulation in the peripheral blood vessels. And to ascertain whether it's there or not, you may have to do something called a what? In your feet. What do you do with the feet when you want to check to see if you get them? You guys can't do. Big time thing. Using your hands. You squeeze a toe. And when you squeeze a toe, you're looking for what?
Peripheral refill,
For what type of refill?
capillary refill time,
And how long should capillary refill take?
3 seconds. Less than 3 seconds.
2 to 3 seconds.
Yeah.
Hold your finger up. Take your thumb. Squeeze it. What happened to it? It gets red, right?
Yeah.
Release it. Gets back. Good. So your capillary refill is good. Right. Now let's go to, let's check now the feet. You want to check your, what you check in the feet? What normally for the nurses, what do you normally check with the feet?
The bony prominence.
Pedal pulse.
Pedal pulse, right.
You want to put your feet.
Right.
Pedal pulse, is it present? It's not. Especially when you have patients who are having what? Fractures. So I want you guys to use that same thing. Go down that line. What are the normal things you would do? Don't go yet into the Doppler studies and all that sort of stuff. Just think about the things that you use a nurse, what you would look for. That's where now your assessment is going to come in. Because before you get to Dopplers, you have to do what? Inspection of your patient. That's your assessment. So when you inspect, what's it you're looking for? What you're looking for is going to be based on what the patient is complaining of, right? And that'll be a focus inspection, right? But if it's something generalized, you're doing a head to toe. And when you do the head to toe, you do it because you know what's normal. We know how a head's supposed to look like. We know what the color of the eyes is supposed to look like, right? We know the color of the skin that's supposed to be look like. Not supposed to be having what? Pallor, meaning blood supply, right? Hemoglobin level, being yellow, being blue. So when you're talking about things like blue babies, we're not talking about junior blue. We're talking about babies who have what? Poor oxygen. Blue babies. And then now you got yellow babies.
Jaundice.
And the jaundice is same blood, right? But this is where the mother is involved, right? If the mother is RH negative and get an RH positive baby, and your body start to break down those red blood cells. And this increased bilirubin in the blood because of the breakdown, the hemoglobin's getting, and you get the baby's gonna be yellow. And you put it together like that, it's gonna be easier for you to learn. So when you're picking up all those big bad words you have out there, it's gonna make sense to you because you got an insight into it. Okay? So with this here, arterial disorders, we're focusing on the arteries. And then you gotta ask yourself, what does the artery do in the body? What's the role of the artery in your body?
Supply nutrients, oxygen, blood.
It's a transport system, right?
Transport the
What's the
train.
transport?
Blood.
Come, you gotta be better than that. You gotta be specific.
Transport oxygen-rich blood.
There you go. So the arteries is specifically only oxygen enriched blood, right? And we know the hemoglobin is responsible for carrying that oxygen. Now, what can cause problems with this oxygen-rich blood? Think about it. Don't even think of no disease that you read about. Just think about it. Blood is going somewhere, or blood is being happen. What can happen?
Blockage.
You have poor circulation. Where? Where you have this poor circulation?
In the feet. It can be in the
Within.
feet, it can be in the
In extremities. In extremities. Maybe in the lower extremity.
Poor oxygen circulation in the lower extremities. And that's right, you're going to peripheral, right? Peripheral circulation. Our peripheral circulation you got in the feet. What the problem when the people have diabetes, they say you get poor oxygen in the legs. What's that?
They can't probably feel tingling in the foot either.
Right. That's signs that you get. But what's the condition? Exactly what you see up there.
Deep vein thrombosis.
Peripheral artery disease.
Okay.
Look at peripheral artery disease, please.
Peripheral artery disease.
Peripheral artery disease.
No. Peripheral artery disease. Peripheral artery disease is an abnormal narrowing of arteries.
Which reduce the blood flow to the
Go ahead, I'm listening.
Somebody read, anybody please.
Peripheral artery disease is an abnormal narrowing of the arteries other than those that supply the heart or brain. Continue? No? Okay.
Peripheral artery disease is anywhere in the body that blood supply is needed except the brain. Alright, so let's go on. What else?
When narrowing occurs in the heart, it is called coronary artery disease, and in the brain, it is called cerebrovascular disease. Peripheral artery disease most commonly affects the legs, but other arteries may also be involved, such as the arms, the neck, or kidneys.
Right. But the PADs is usually the legs. And what can cause peripheral artery disease? We said narrowing of the arteries. The blood supply is not getting down there. And somebody said tingling of the feet.
Tingling of the feet.
What's young lady here name?
Yes. Sasha.
Tasha.
Sasha.
Who said she? Sasha. She's
Tasha.
Tasha.
My mother never named me son.
Your mother never named you, sir?
Natasha. Sasha. She named me.
Oh, you're Tasha.
Sasha.
Oh, sorry, Sasha. So when a person having these tingling, as Sasha said, in the periphery, there's an indication that the blood supply is what? Poor. And the blood vessels
Compromise.
are narrow. And then you ask yourself, well, what can cause those blood vessels to get narrow?
Because it does reduce blood flow.
The calcium buildup.
Sickle cell anemia.
Injuries.
Diabetes. Look at diabetes. Diabetes is very high. But look at, for the peripheral, look at diabetes. right? And diabetes is going to come under your endocrine system. Endocrine disorders, that's where diabetes will come on.
You ready?
Right? So let's see
diabetes, peripheral vascular disease, diabetes. So,
Peripheral vascular disease, diabetes, or just diabetes?
I think diabetes because they don't go
cause
together.
of, alright, go with diabetes. Let's go with diabetes.
Alright, diabetes is a condition where the body does not produce insulin or does not use it efficiently. While it can lead to dangerous complications, diabetes is manageable. There are different types of diabetes with varying effects. That's all I got here.
No, that's not what we're going. We go with PAD. Diabetes and peripheral artery disease.
And okay, this condition, This looks interesting.
I'm getting thirsty, guys. Come on.
What if? It's a lot, Mr. It's a lot, Professor.
It's a complication of diabetes that happens when the blood vessel in the leg become blocked or narrowed due to fat deposit.
Alright, look. The diabetes cause changes. And most persons you see get something called a transmet. A transmet amputation. And what's transmet amputation? Transmetatarsal. When you see those persons have their toes cut off. When persons are walking around with shoes that is too tight for their feet, and they're having ulcers, and they don't know because they don't feel.
What's transmit?
Metatarsal.
Diabetes. A lot of persons, and by the way, guys, 100,000 persons died last year from diabetes. And now they're putting it out as now it's going to be like, oh, not a warning. They're going to be putting things in place because it's now becoming a crisis. Diabetes has become a crisis. 100,000 people plus died from diabetes last year. So now they're asking the president and everybody to look into it. And if many of us might be diabetics and we don't know. Because we never check for it. Sometimes we get like this in the head. Sometimes things happen.
Silent killer.
A lot of our children, you see the size of the kids running around the place? They don't run around no way. Because they get busy playing what?
Yeah.
So they have no exercising and they're drinking all the sweet sugary stuff. Those are the kids that of tomorrow that walking down the street sick. But you gotta be going all the time to wherever. Unfortunately, we love our kids. But sometimes you gotta have tough love. Sometimes you have to have tough love. They just kind of just sit inside a room and oh no, they must have at least an hour or so outside doing things. That is why you find now there are more children getting this COVID-19 with this last go round. A whole lot of children died with this last COVID. Was it
Omicron.
Killed children. A whole lot of children died. Before they were protected, right? Their body. Because vitamin D got there. A lot of kids don't get it.
Just like me, you don't get it. Every time you go to the doctor, he said what? You got your vitamin D3 is lacking. Because we do what? Jump in our car, go to work, get it back, and back in the house. Every go outside, the sun is too hot, you run inside the shade. So, problem, right? So the arterial disorders, peripheral circulation, is what we just talked about. What can affect your peripheral circulation? What else apart from diabetes? You said narrowing the blood vessels, right? So what can narrow the blood vessels? We talk about cholesterol. Anything else? Obesity, pressure on the blood vessels. What about aging process? You think that's a problem? What about eating too much salt? Not a problem. Remember we did early on, we did a comparison between atherosclerosis and arteriosclerosis. Guys, remember that comparison? Now, what was that comparison about? What was the comparison about?
What about when you have Frank?
Again? No, let's find the comparison between the two first. We can come to that. What was that comparison about? No. What is the difference between atero and we went through this, guys. What's the difference between atherosclerosis and arterial? And I said we gotta be very careful. We got to use them sometimes interchangeably. Are you kidding me? Let's go over here. When you have your hardening of the arteries, you're gonna go to your arteriosclerosis. Hardening of those arteries. And the atherosclerosis is when you have that deposition of fatty layers. And we went through this, guys. Come on. Don't forget these things because we're getting into these blood situations now. So you can have problems, either one. Now what you were saying about the cramp? Hey. Don't tell me you forget it already. I'm the only person here who should have short-term memory problems. You get what? You get cramps with what?
part of the now,
Cramps?
Yeah.
Not really. Not really. You have different things, electrolytes imbalance can cause cramps. Right. You can have different things. You can have muscular cramps related to if you don't use it. But it could cause you to get, normally athletes don't get cramps unless they do go over. Like you're running, and then they get a cramp, right? But normal man don't want to run. And you get more cramp than the athletes. You ask yourself why? Because the muscles have not been stretched. And a lot of times, and this, I think I told you guys before, you look at Mother Nature. Anytime a cat gets up and you don't kick them, what do? They stretch. You see a dog get up and you don't chase him, he stretches out. We don't use these stretcher muscles. And that's why we have problems. So stretching the muscles is very important. Stretching. You ever see those guys before they run? No, stretch, right? You gotta stretch.
Warm up.
When you get up in the morning, don't jump out of bed and run to the bathroom. Jump out of bed, get up, And what? Ah, they got another day coming up. Stretch. Anyhow you want to stretch.
Do you do it?
Me? I always stretch, man. I always stretch. When I go to bed, I point my toes. I point my toes. I walk, I point my toes. I look at those young ladies how they walk. One foot in front of the other. That's how it goes. One foot in front of the other. But remember I told you that when you walk, you make what? You stride. So you can stretch the muscle. Then you make short, choppy steps. Alright? So that will help with the problems you have. And like you two dear young lady said, when you're dehydrated, you're not drinking enough fluid, you can have that problem also. Alright. So now, DVT. Because tomorrow we're going to be coming into these here. So let's look at quickly at DVT. Now, what the vein does is taking back to the heart, right? So now we have the deoxygenated and all of them sort of stuff. So the big problem now is what is going back to the heart. And if you have a vein that has a thrombus, that's serious. It's going to cause a blockage.
That's right.
A blockage can lead on to venous insufficiency. Not enough blood, right? Yeah. And a blockage can be a big problem. Blockage in the legs. Swelling of the legs. Edema. One of the things that they have, alright, come back. One of the things they have, you have some people with them black lip foot. Are you black?
Yes.
The ones who got them thing called like sore?
Yeah.
Because, why?
Circulation.
So if the blood is supposed to be what? Going away, right? But being blocked, so what thing is going to happen? The foot will start to get big and it's going to look black. No, cellulitis is when you have an inflammation of the tissues. Remember ITIS, inflammatory. And it is not like when you have the lymph thing here, right? But it does have a relationship because remember, the lymph is plasma that has become lymph at the level of the capillaries and it's put it back into the system. But in this case, you have nothing can go, so if nothing's going back. And when we nothing go, you have a lot different. But if you have some of the major ones, like deep vein, we have the bigger ones, are being blocked, then yes. And these persons, you could end up with something called a stasis ulcer. So please look up the word venous
stasis ulcer.
Okay.
You ready for the definition, Mr. Wise?
Yes, please go. That's it.
What is a venous stasis ulcer? Venous stasis ulcer is a chronic condition that involves blood circulation insufficiency. Venous stasis ulcer is a localized ulceration and is also referred as varicose ulcer, as it basically affects the legs or lower extremities.
Alright, now look at the image.
Well, I got my image right here.
So once you don't get that blood going back, it's going to create situations to get an ulcer. And when people get an ulcer in that part of their body, that's the one they call like sores. That's the one that don't want to heal. Okay? Look at the ulcers in the legs.
Oh boy.
Anyway, the blackness is related to the
Yeah.
corporation, and that leads to the breakdown, and with the breakdown, those sources are run for a long time. In third world countries, they like to call it like sore because it's not healing. It's there all the time, and the legs is big, and then it looks terrible. Right? Just look at some images, so you know. So if you come on and do it.
Want me to send that one too? Alright.
Guys, believe it or not, and stay with me. As nurses, we walk around a lot, right? So one of the things we have to do is to ensure that our venous return is good. So how do we do this? We help by putting on the anti-embolic
Stockings.
which is also known as TEDs. You put the TEDs on, this will help the return of the blood, the venous blood, not the arterial, we're talking about the venous. And will prevent situations like that. So that if a person have like the venous problem, and the moment they like, sometimes they hit the foot on a bed or something like that, a sore will come up. And guess what? It's not going to be healing. It will just get worse. And that is, you know, and that's why at the same time with diabetics, you know, peripheral vascular disease.
I've seen that before.
But these are things you have seen, right?
Oh, wow.
Those are things you've seen in your neighborhoods. Right here in America, it's not only back home. Right here in America, you got people with some black. If you look in the nursing homes, you got a lot of them with their venous stasis ulcers and the foot black. So this is not just in third world countries, it's happening right here. And like I just told you, they said so many people die from diabetes. Guys, take a quick look at not just the family members who are diabetic, but look at the persons who are at risk for diabetes. And persons at risk for diabetes should do it at the A1C to see what are their numbers. No, persons who are vulnerable, persons at risk. Lifestyle. Persons like to go and drink a lot of rum and them sort of stuff. Persons who like to go and eat out and drink and eat a lot of high carbohydrate meals. People who don't exercise. Exercise in our room with you, Nadia. Right, Nadia? I'll tell you, oh, take a walk and you are right. All right, any questions related to what, because tomorrow we have to go much more in depth into this. No two ways about it. You gotta read about the two types and all the conditions that relate to those two types. So that's be your focus. Yes.
If I make an announcement, that's it.
All right. If you want to make an announcement.
All right, everyone. Quick announcement. All right. I know a couple of people don't have Microsoft Word. I know a couple.
No, you got to start 1 more year. So it's okay.
I know a couple of.
You got it already, though. When you get it.
Okay, birthdays.
All right. I know a couple of y'all don't have Microsoft Word. I'm gonna try to individually assist you guys with that. If I have it, I'll try to share it to you guys individually. Also, I don't know if you guys are aware, but every Monday and every Tuesday, I try to get here at least 2 hours ahead of time, so we can do a quick review of questions and answers. All right, that will be very helpful because the more you do, the more you will retain. I'm trying to also include Sunday. That would be like a Zoom. All right. So I'm gonna put my number up for the new set of classes. But I think a couple of you already have my number. book my number up. You guys just text me and I'll add you guys on Sunday. If you guys are interested, just let me know. All right?
Thank you.
So my number.
I thought he was gonna, I was gonna have a party He didn't know, I thought that's what he was gonna do. Happy birthday. Listen.